Hi, my name is Ira. I'm a nurse practitioner student. I'm going to perform an exam on your head, face, and chest. Can you verify your name and the report for me?
Gurpreet Kaur, 103092.
Very good. It looks like you are draped. I washed my hands and I have gloves on. I'm going to start with your head. Your skull is normocephalic, traumatic. I'm going to go ahead and palpate it and also inspect it in the hair. Any tenderness where I'm touching?
No.
No tenderness. So no scales, no lesions, no masses, no tenderness. The hair is equally distributed, no signs of alopecia, and the contour is round and smooth. I'm going to go ahead and palpate the temporal artery. Any tenderness?
No.
No tenderness, and the pulses are two. I'm looking at your face, and your eyes are. Your face is symmetrical, no scars, no lesions, no mass, and no edema, no hirsutism. Your eyes are centrally located in the sockets. Do you normally wear glasses?
Yes.
Okay, I'm going to ask you to cover one eye and read this for me.
LTFPH.
Very good. I'm going to ask you to cover the other eye and read it backward.
HPFTL.
Wonderful. The patient vision is 20/20 with the glasses on, and I am inspecting your can I take this out? I'm inspecting your eyebrows. They are symmetrical. The hair is equally distributed. The medial and lateral canthus are symmetrical. I'm gonna go ahead and look at your eyes. No excessive tears, no dryness for lacrimal glands, and the conjunctiva is pink. No exuding, no swelling. The sclera is white, no signs of jaundice. The iris is brown, and no laceration, no corneal laceration or opacity. I'm going to shine this light in your eyes. I'm looking for the pupils. The pupils are about 3 millimeters. They are equal, round. They react to light and they accommodate. I'm going to check for the direct and consensual light reflex. I'm going to shine in the left eye. Both pupils constrict. Direct light reflex in the left eye. Consensual light reflex in the right eye. Shining in the right eye. Both pupils constrict. Direct light reflex in the right eye, and consensual light reflex in the left eye. I'm going to ask you to look at that wall. The pupils are dilated, and look at my finger now. The pupils are constrict and they converge. That's for convergence and accommodation. And now I am going to ask you to focus on my finger. Do not move your head, just your eyes. Very good. That's for extraocular movement, and they are intact. Cranial nerve 3, 4, and 6 are intact. And now I am going to go ahead and perform a fundoscopic exam. I'm going to turn the lights on. I'm going to go ahead and approach the patient. I'm going to go ahead and approach the patient with my with my left eye to her left eye from about 14 inches. I'm looking at the red reflex is intact. I'm going in to look out for other structures, and now I'm going to do it for the right eye. With my right eye approaching from 14 inches, the red reflex is intact. I'm going in to look for other structures. No opacities, and no nicking, no crossing, and no swelling, no bleeding from the retinal vessels, no exudate, no lesions for the macula. The optic disc is pink and round, and the cap to the optic disc is about 0.4 bilateral. Those findings are bilaterally for all of them. So now I'm going to go down to your nose. I'm going to occlude one. Can you take a deep breath for me? And now, can you breathe in and out? So the nails are patent, and now I am going to ask you to close your eyes and tell me, what do you smell? Sorry for this.
Coffee.
Okay. Now I'm going to ask you to close your eyes and tell me what you smell.
Peppermint.
Peppermint. Very good. The smelling is intact. So now I'm gonna go ahead and palpate your nose. Your nose. Any tenderness? No. Any tenderness? Maxillary. This is maxillary sinuses. Any tenderness?
No.
frontal frontal sinuses, any tenderness? No tenderness. So now I'm gonna go ahead and look into the nose, and I am going to look the right nose, the left nose, and I'm gonna look into the right nose as well. The septum is a midline, no signs of perforation. The mucosa is pink, no lesion, no swelling, no drainage, and no polyps. So now I'm gonna go ahead and move down to your mouth. I'm looking at your lips. They are pink, they are moist, and they are symmetrical. So now I'm gonna ask you to open your mouth and say ah.
Ah.
I'm looking for all the structures in the mouth. The mucosa, the gums, the tongue, under the tongue, soft palate, hard palate. The tonsils are all pink, moist, no signs of lesions or any exudates from the tonsils. And the tonsils are about 2 plus, which is normal. Now I'm gonna go to your ears. I want you to cover your left ear and tell me if you can hear me rub my fingers.
Yes.
Okay, I'm gonna go to your left ear. Tell me when you can hear me rub my fingers.
Yes.
Very good. The patient gross hearing is intact. So now I'm gonna go ahead and perform a Weber test by putting this on the top of your head, and you tell me if you hear it in 1 or 2 or both ears.
Both ears.
Both ears. I'm gonna put it on the mastoid process and ask you when you stop hearing it.
Stop.
Okay?
Stop.
Okay? On the other side.
Stop. Stop.
That was it for rhino test. And now I am going to go ahead and look at your auricles. I am inspecting your auricles. They are symmetrical. I see no lesion. I see no nodules and no swelling. I am now palpating the mastoid process. Any tenderness?
No.
I'm touching the targus. Any tenderness?
No.
No tenderness. So I'm gonna go ahead and look into the ear. I'm gonna start with left ear. I'm gonna put the auricle up and back, and I'm looking into the ear, and the cone of light is at 7, and I'm looking at other structures as well. I'm gonna move it to the right ear. I pull the auricle up and back. The cone of light is at 5, and I saw other structures. The tympanic membrane is pearl gray, no scarrings bilaterally, and no scarring, no signs of perforation. The malleus and the paraflacida bilaterally, they are intact, and no swelling, no bulging, and no signs of laceration. So now I'm gonna go ahead and go down into your neck. Can I check your neck? Your neck is symmetrical. The pulsations are normal, no masses. So now I'm gonna go ahead and pop it for the lymph nodes. Periauricular, postauricular, occipital, tonsillar, submandibular, submental, superficial cervical chain, deep cervical chain, posterior cervical chain, and supraclavicular. Any tenderness when I palpate? So no tenderness. Now I'm gonna go ahead and palpate your trachea. Tell me, can you swallow for me? Very good. The trachea is a midline, no deviation, no tenderness, and no swelling. I'm going to check your thyroid glands. Any tenderness?
No.
Okay. The lobes are symmetrical bilaterally, and they are noted. No swelling and no swelling. So now I'm gonna move on. Now I'm gonna move on to the chest. I expose the anterior chest, and I leave the rest of the body covered. So I'm inspecting. I see no masses, no lesion, no scarring. I'm going to go ahead and palpate for any masses. Any masses?
No.
So no masses. I'm gonna go ahead and palpate. So the resonance is heard on all lung fields, which is normal. That means no consolidation. So I'm gonna go ahead and now listen to your lungs. At this time, I want you to take a deep breath as I listen. Very good. Now I want you to turn around so I can listen to the other side. I'm looking at your posterior wall chest. It's intact. I don't see any lesion. I don't see any scars. And now I'm gonna go ahead and palpate for any tenderness, any masses, any tenderness. No tenderness, no masses. I'm going to perform. Egophony, and then I'm going to perform tactile parameters. When you hear me touch, say 99. 99. Very good. I'm gonna go ahead and press. Okay, I hear resonance on all lung fields, so I'm gonna go check for the diaphragmatic excursion, and I'm gonna percuss again. I'm gonna ask you to take a deep breath and then exhale and hold. I hear dullness, so I mark the spot. I'm gonna do it again. I'm gonna ask you to inhale and hold. I hear dullness. That means the diaphragmatic excursion is about 5 centimeter, which is normal. So now I'm gonna go ahead and listen to your lungs. Take a deep breath as you feel my stethoscope. Deep breath, 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 deep breath. Very good. Now I'm gonna ask you to say 99, to say E as you feel my stethoscope. We are checking for egophony.
E, 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 E.
Very good. I hear E, no A is heard. And now I'm going to ask you for one last time to whisper 1, 2, 3 as you feel my stethoscope. Whisper. Very good. The sounds are muffled and they are quiet, which is normal, and that's the end of the exam.